Hello, everyone, and welcome to our presentation on the project, Trusted Information Sources Amidst the COVID-19 Pandemic, Extension Professionals' Worry, Stress, and Preparedness. So before we begin, we would like to introduce ourselves. My name is Cheyenne Heflin. I've just received my bachelor's in psychology from the University of Florida, and I'm planning on pursuing a PhD in clinical psychology.
Hi, my name is Amit Swissa, and I graduated from the University of Florida with a Bachelor's of Science in Psychology and a minor in Innovation and Entrepreneurship, and I too am planning on pursuing a PhD in clinical psychology.
Amit and I have been working with the Southeastern Coastal Center for Agricultural Safety and Health during our final semester at the University of Florida. As part of the ISASH Agricultural Safety and Health Initiative, the center evaluates occupational safety and health of workers in agriculture, fishing, and forestry in the southeastern United States. Given the recent pandemic that has shaken the globe, the center has been concerned with the effects of COVID-19 on both their professionals and their clients. The purpose of our project was to examine how extension professionals' trust in information sources, such as healthcare workers or news reporters, influence their feelings of worry and preparedness against COVID-19 during this pandemic. We also wanted to examine implications of these feelings on extension professionals' ability to meet client needs during the pandemic and beyond. Extension professionals are a direct link between the center and their clients in agriculture, fishing, and forestry, so it's important to examine how the pandemic is affecting them. We believe that feeling more worried about or less prepared for the COVID-19 pandemic leads extension professionals to being less effective at meeting their clients' needs. The data we analyzed for this project was collected through a survey of extension professionals served by CDC NIOSH funded centers. We analyzed a total of 1,470 responses from 24 states, collected between May and December of 2020. This was part of a larger project to collect information on concerns related to agricultural safety and health, as well as larger perceptions and impacts of the COVID-19 pandemic, as previously discussed in Sampson et al. 2020 and Israel et al. 2020. For our information sources, respondents were asked to rate their trust for healthcare service providers, news reporters, local, state, and federally elected officials, university administrators, extension administrators, and social media influencers. Respondents were then asked about their confidence in having information to protect themselves from COVID-19, their level of worry about contracting COVID, how often they engaged in health practices to prevent COVID-19, and their likelihood of receiving a vaccine. Finally, we created a stress index variable to examine various stressors professionals may be experiencing related to the pandemic. On this slide, we've created a conceptual model of how we believe that trust in information sources has a downstream effect on extension professionals' ability to meet client needs. Levels of trust in different information sources can influence extension professionals' attitudes about the pandemic and their confidence in having information to protect themselves. This then can affect several personal outcomes for extension professionals, including how often they engage in practices to protect themselves, how many stressors they are encountering in their day-to-day lives, and how worried they are about COVID-19. How positively or negatively these variables influence them will determine whether these professionals are able to meet their clients' needs. And now Amit is going to walk us through some of the key results we found during our analysis.
Thank you, Cheyenne. So for each graph, I'm going to give a short summary describing our analysis and then provide a few seconds in between to allow the audience to examine the graphs itself. For our analysis, we examined survey questions where respondents rated their feelings from a low extreme to a high extreme for each topic. For example, trust in particular information sources. We ran a cross-tab analysis between our independent and dependent variables along with a chi-square and Kramer's V-test. We ran this test to determine associations and effect sizes. Variable levels with low numbers of respondents were compiled in order to reduce potential outlier effects. For our graphs, we highlighted overall trends by examining one particular level for each variable. After extensive analysis of our data, we found that as trust in information sources increased, confidence in having information to protect oneself from COVID also increased in extension professionals. As a representation of our information sources, we included data from extension professionals, news reporters, university administrators, and healthcare service providers. Likewise, we found that as trust in information sources increases, worry about contracting COVID-19 increases as well. We continued our analysis by examining the possible correlation between confidence in having information and stress level index in extension professionals. Our stress level index measured feelings of stress on receiving medical care, on getting medication, and obtaining food for oneself and family. We found that as confidence in having information to protect oneself increased, stress index levels decreased. Additionally, we discovered that by having information to protect oneself from COVID, one is more likely to perform practices to fight COVID-19. These practices include social distancing, wearing face coverage, and cleaning and disinfecting surfaces. In our last analysis, we found that as confidence in having information sources increases, the likelihood of getting the vaccine increases as well. Now, when looking at our important trends, there's a clear association between trust in information sources and confidence in having information to protect oneself from COVID-19. This demonstrates that people do rely heavily on outside sources to get their information. It is interesting to note that trusted information sources didn't necessarily reduce the worry people may have about the pandemic. Furthermore, when examining how confidence in having information may impact outcomes in extension professionals, increased confidence led to a decrease in our stress index, which examined pandemic-related challenges. Finally, increased confidence in information led to an increase in engaging in activities that would reduce odds of illness, such as vaccinations and health practices. Given that there's a strong association between trust in information sources, with the exception of social media influencers, and confidence in having to protect oneself from COVID-19, the Southeastern Coastal Center for Agricultural Health and Safety may find benefit in targeting information campaigns for extension professionals through more official channels. Campaigns within their own administration, especially, may prove useful given proximity to extension professionals and the significance of the relationship found. It is interesting and important to note that worry also increased with trust in information sources, but did not show a significant relationship with having information to protect oneself. This suggests that while people are getting information from people they trust, this information is not helping to reduce worry they may have. So another possible application may be to create programs or campaigns targeting stress relief in extension professionals.
We have a few acknowledgements we'd like to make before officially ending this presentation. We would like to thank the National Institute for Occupational Safety and Health, as well as the CDC, for funding and supporting the project that we have been working on through the spring 2021 semester, especially the CDC, because this research was supported by a grant from the Centers for Disease Control and Prevention. We would also like to thank the University of Florida Active Learning Program, which allows students to participate in internships for credit during one of their semesters at the university, which is how Amit and I were assigned onto this project. We would also like to thank the University of Florida Active Learning Program for allowing us to participate in this project for this semester. The Active Learning Program lets students participate in an internship as well as obtain professional development experience for a semester during their time at UF. Finally, we would like to thank Dr. Sebastian Galindo, Dr. Glenn Israel, Dr. David Deal, Dr. Serap Gorucu, and Cassandra Ward, along with the rest of the team, for allowing us onto their project and being really supportive and inspiring mentors throughout the semester. Without them, this presentation wouldn't have been done. And that is the end of our presentation. If you would like to contact Amit or myself, we have left our emails as well as our LinkedIns on this final slide. Again, thank you very much for letting us come and discuss the work that we've been doing for our final semester of our bachelor's degrees.
Thank you.